Yeah,
তুমি
we are live.
আগৰ পৰা সুধিব লাগিব দেই কোৱেশ্চনবোৰ চব কোৱেশ্চন একে সুধিব লাগিব
Yeah. Good evening, ma'am. Welcome back. So we were discussing about reproductive health, and while we lost connection with you, we compiled a few questions from the listeners. So I'll put it up one by one, so that we can get your answers. Um, so the first question was, there was one girl who had painful periods. So she wanted to know if it's safe to have medicines during periods, like painkillers and stuff.
Yeah, there is no contraindication. She can have no problem. No problem having medicine during periods. Only sometimes, suppose someone is having some tablets for blood thinning and all, there might be a little bit of bleeding. Otherwise, there was no such adverse effect of medicine on periods.
Right. So another listener had a question about the menstrual cups, like how to use them and how to basically use them always, because in Northeast, like availability of clean toilets is an issue. So she was worried about the fact that she might get infected. So how does she go about that?
Menstrual cup is not very popular in this part of the country. So some people are using it, but while inserting and all, you must wash your hands properly. Hygiene must be maintained properly. So that is basically, this is the main idea of using the cup.
Okay. So, ma'am, there was another concern raised by one of our listeners. She was basically worried about the oral contraceptive pills that women of the younger generation use. So she wanted to know if there are, alternatives to it. So if you could kindly tell us.
Alternative to oral contraceptive.
Right.
See, many people have some myths about oral contraceptive. Actually, oral contraceptives are very much safe. Nowadays, very low dose pills are available. Hormone content is very low. People, ladies can use it. This is very safe. There is, because they have some misbelief is that once you stop the medicine, you will not get pregnant. That is absolutely false. Some believe that there is weight gain. Not at all. Weight gain is, there are other factors which are responsible for weight gain, because previously very high dose hormone content was there, and those pills, of course, there was a little bit of weight gain. But nowadays, whatever pills are available, they are very much safe. There is no other problem regarding weight gain and other side effects. Rather, I will tell you, because there are some other non-contraceptive benefits. Suppose you have this medicine, and besides protecting you against an unwanted pregnancy, it protects, it regulates the menstrual cycle, it controls the bleeding, and another is that it is seen that people who are using oral contraceptive for a long time, there is incidence of ovarian cancer are less. These are the benefits. Suppose someone doesn't want to go for oral contraceptive, other methods are there, like barrier, condoms and all, and then your property can be used. These are the methods.
Right. So, ma'am, there was another concern, like what are the, platforms or what are the avenues available for trans people to ensure proper reproductive health?
But then I couldn't get you.
And what are the avenues or what are the platforms available for trans people to ensure proper reproductive health?
Proper reproductive health.
Right.
See, there's no hard and fast rule that these are the thing. Like proper reproductive health means you should have a regular periods. There should not be sexually transmitted diseases. One should be protected against sexually transmitted diseases, and others are, one should be able to prevent against unwanted pregnancy.
Right.
I think
Uh, Right, ma'am. There were a few more questions. Another girl, she had irregular periods. She was really concerned about her health. Yeah, so she wanted to talk to you about it.
irregular periods. Irregular periods, there are different because it may be a very frequent period. And see, normally it's a 28-day cycle. Sometimes it may come a little early. 7 days plus minus, we consider it to be normal. For some girls, suppose at 45 days, suppose she is getting regular periods, yes, that is normal for her. Suppose a girl gets her periods after 3 months, into 6 months, that we consider as
Ma'am, your audio is not working.
that will need treatment. And there are different causes. Sometimes stress may cause you irregular cycle, sometimes some hormonal problem, and most commonly nowadays among the young girls it is seen it is because of PCO.
Right, right. Okay, ma'am. Another thing we were discussing is the medical termination of pregnancy. One listener actually raised the issue. So basically, despite being legal in India, many couples or many young couples basically they find it difficult to go for MTP. What do you suggest how they should go about it?
See, nowadays government has made it very liberal. MTP, we have an MTP Act. According to the MTP Act, there are some designated doctors, designated places where they can go for MTP. Anywhere, everywhere, it cannot be done. And another thing, nowadays the pill is available. You can have this pill, but it's always better to go to a proper doctor, get her checked, then you go for termination because that rules are very strict and well defined. Who can do, where it can be done, and what are the indications they have written. Where are the causes the doctor can go for MPP.
Right,
Normally, there should not be any problem if they abide by all the rules. And or in India, MTP is permissible only up to fifth month, that is 20 weeks. Sometimes some couple come, especially young girls, they come when the pregnancy is advanced, more than 20 weeks. They press us to go for MTP, but that will be an illegal abortion. These are the things.
right. Ma'am, we were also talking about reproductive health in rural areas. How do we basically engage women in such conversations? Uh,
Nowadays, rural setup, the government has done a lot of work regarding women's health in the rural areas. Nowadays, they have the ASHA workers where that they ensure that the lady gets proper care during pregnancy, and the small girls, even they are getting proper care. They take them, that is, they take the proper nutrition and everything. But previously, this was not there. That is why there was a lot of maternal mortality was there. In India, the maternal mortality is coming down. But surprisingly, in Assam, we have a very high maternal mortality. We have to deal with it.
right. And ma'am, how do women deal with endometriosis?
Endometriosis is an, I will say it's an enigmatic disease. Actual cause is not known. This is a very distressing symptom, and sometimes it is like it hampers in getting pregnancy for the lady. So proper early intervention is the best, and repeated surgery should be.
Ma'am, I also wanted to know more about uh, other issues such as fibrosis and cysts.
What cysts?
The cysts that happen in ovaries, like
Polami, your voice is not clear. It is echoing.
Hello?
That's echoing, yeah.
hello. Can you hear me?
Yeah. Say.
It's echoing. Can I just
Yes, it's echoing.
unmute? Is it okay now?
Yeah,
No,
I
still
can
we
hear
got
you.
getting the noise.
Just give me a moment.
Nilakhi, till then I have another question, quick question. So my question is,
What?
some people have lots of pain, right, during period. Why do they have lots of pain?
Okay.
And is there a way that they can reduce the pain?
See, many a times we cannot find any cause why she is getting pain. So regular exercise and sometimes painkiller might help. And sometimes endometriosis may cause severe pain. Normally it is very progressive, which gradually goes on increasing. There are a lot of medicines nowadays available to treat endometriosis. And sometimes this endometriosis comes with an ovarian cyst. And in that case, suppose the cyst is very big, then we'll have to go for surgery. Otherwise, for small cysts, there are a lot of good medicines available now.
Right. Ma'am, so how do young women basically save themselves from STDs?
We are getting the noise again.
Let's continue.
Sorry.
Yeah, same. What
Ma'am,
else you
how
want?
do young women save themselves from STDs?
STD.
Right.
One should avoid multiple partners
Right.
and proper vaginal perineal hygiene, and another is using a barrier. These are the three
Ma'am,
main.
also one of our listeners wanted to know, get some tips on intimate hygiene.
Intimate hygiene.
Right.
There are intimate hygiene. You must get your undergarments properly washed, dried in the sun, direct sunlight, and use of sanitary pads during periods, because still there are many ladies who do not use sanitary pads. They use clothes. That is not very much hygienic. Better to. And another thing, during your taking bath and all, never use this Dettol, Savlon, all these things in the private part. And there are some lotions available for the wash. And these are the main categories. Only thing is the menstrual hygiene should be maintained and clean clothes.
Right. Thank you so much, ma'am. I think these are the questions and queries. Thank you so much for cooperating and answering all the questions.
Nilakhi,
Thank you.
I had one more question though. So why did you choose to be a doctor, and why you choose to be a gynae?
Pardon?
Why you choose to be a doctor,
Yeah,
and
that
why
is I wanted to
gynecology?
be. Actually, I wanted to be a doctor from my very childhood. Luckily, somehow I got the seat. And definitely, I wanted to work for women. That fascinated me. The childbirth that fascinated me a lot. So that is why I wanted to be a doctor, gynecologist, so that I can help that woman population of our country.
And during this pandemic,
Yeah.
do you see more number of cases because more violence, sexual violence this time,
See,
or
those cases
domestic violence?
actually, though there is a record is there, but as a doctor, as a gynecologist, we have not come across, because this is dealt by the government setup and medical legal department and all. We are not getting as such domestic violence case. Yeah,
Okay.
but one thing is that when this other good part we are seeing from the lockdown, I have a lot of infertility patients, and who have not conceived for so many years. Many of them has come with a positive report of pregnancy. I am very much happy on that part. You are talking
Okay.
about domestic violence. I am talking about the absolutely opposite. So
Okay.
domestic violence, of course, on record it's rising, but as a gynecologist, we are not getting those patients.
Okay. 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 These are the thing. All right. Polami, you had covered all the question, right?
Yeah, I think so.
All right.
I'm
Th-
really sorry for the problem we had in the evening because
No
it was
worries, ma'am. We
unavoidable.
understand.
Because you know, obstetrics and gynecology, there is no definite time.
I
We do not have a timetable. At one patient comes in emergency, we'll have to attend it.
we
So this is
understand,
that
ma'am.
is
And
very
you are
challenging.
actually our real hero and like you help us survive. So we are really thankful to you. And may God bless you. Thank you so
Thank
much
you,
for answering our queries.
thank you so much.
all
I
right.
really enjoyed the show.
All right.
Thank you, Milin.
Yeah. Thank you. Bye now. Good
Good
night.
night, ma'am.
Okay, thank you.